also a breast cancer survivor, 14 years breast cancer survivor. My best friend, I was diagnosed 6 months after she was, and I watched what she went through and figured I've got to change the system, and my background is medical anyway. But what I'm going to talk to you about is basically how to mess with your insurance company and get things paid for. So there are little techniques you can do. There are really 4 ways that healthcare is paid for. One, you pay out of your pocket. Medicare, if you're that age, I finally made it. Medicaid, which is a federal program but state-run, and then regular state insurance. And what you need to know is that self-pay, you're the one who's in control of that. It's your money. You're paying for it. Medicare is federal. There's different ways to get help to get Medicare to cover things. Medicaid is state, so when you need help, you go to your state for that. And then regular insurance is also legislated by the state. And that's how we work the system. So with Medicare, and bottom line is everything is negotiable, whether you know it or not, it really is. And I'll give you some examples. With Medicare, because it's a federal program, everything goes by diagnosis code. And I know that when you reach Medicare age, and you may have, if you have had breast cancer, you're seeing I'll see my oncologist for the rest of my life, my GYN for the rest of my life. I mean, I'm going to see these guys forever. But once you get Medicare age, they're not going to do a pap smear on you because you don't need it anymore. Well, that's not necessarily so. So the way you get Medicare to pay for is whenever you see a doctor, even if it's and doctors close your ears, but to get Medicare to pay for something, you've got to have a complaint. So if you want a pap smear, go in with a complaint. Go in with something. If they have a diagnosis code, it will get paid for. But they've got to have a diagnosis code. That's how you work Medicare with some of the things you want. The other thing is, I have never had an issue with Medicare won't cover some drugs or they change the formulary or whatever. I work a whole lot. My 2 passions are research advocacy and public policy. I work a lot with the lobbyists for the pharmaceutical companies. Anytime I get a call from a patient who's having difficulty getting medication, I go straight to my guys in pharma. And I have never had a patient denied. They are great at getting the meds to them. They may not be able to get them to you totally free, but they can get them discounted. There are all kinds of ways around it. They were talking about genetic testing. I deal mainly with Myriad. Excuse me. Myriad, I was genetically tested because I've got Ashkenazi bloodline, which increases my risk of breast cancer. Basically, if you've got that, you're going to get genetically tested. But I've had a patient her mother died of breast cancer, all her mother's sisters died of breast cancer, her sisters have all died of breast cancer. She has a lump in her breast but hasn't been diagnosed yet, but she can't get genetically tested because everybody's dead. She needs to be genetically tested. So what I did was I called Myriad, talked to one of the nurses there that I know and explained the situation. So that's another way you can get into genetic testing. Okay, there's always ways around it, and you just have to know where to go and who to talk to. If you have an issue with Medicare, I don't even call Medicare anymore. They're worthless. One, you're going to get a different person each time. You're going to get a different story each time. Since they're regulated by the federal government, you call your congressional member. If you do a congressional inquiry, once that congressperson has it and they go to the agency, they have to respond to them within 72 hours. They don't have to respond to you ever, but they do have to respond to them. We've gotten SSI for our patients in 3 weeks with congressional pull. I don't even deal with Medicare. So use your legislators. That's what we voted them in for. They can help a whole lot. Same thing with state insurance. How many of you have HMOs? Okay, if you want some nice reading, go into the Florida statutes. All of insurance has one chapter. Health insurance, auto insurance, home insurance. HMOs have their own chapter. If you go in there and read it, anything that's not mentioned in there, it's covered. And we have gotten lots of things covered because we present them with the statutes. So that's another way you get around it. The other thing with state insurance is, again, if you have issues with Medicaid or your regular insurance, your state legislators can help you with that too. They can do the same thing as a congressional member can and request an inquiry. So that's another way to get things done. Like I said, with the Social Security disability, depending on what cancer you have and what stage it is, you're eligible for SSI. They will always deny you, not if you go through the feds. If you get an attorney, you've lost all rights to appeal using your congressional members. So you want to go through your legislators first, and I've yet to have them fail. But if you get the SSI, in 2 years you're eligible for Medicare, no matter once you get the SSI. It's automatic. If they tell you no, they're wrong, and again, call your legislator. There have been a lot of instances. Florida didn't accept Obamacare, so we have the marketplace. What we're running into now is with the marketplace, bottom line is we're always going to have people who can't afford insurance and who need help. The way it is right now is if you have nothing, I can get you all the treatment you need. If you have some of these smaller insurance policies, especially going through the marketplace, what happens is you'll get a simple one, and the premium won't be that high. Your deductible may be sky high, and it's fine because you're getting all your screenings for free, which is great. I love it. But if they find something in that screening, now your deductible is so high you can't afford treatment. We're seeing a lot of that in the state of Florida. Now I have to start pulling and going through back doors to get the help. Knock on wood, I have a strong network, and we haven't failed yet, but it takes work. That's where, when Dr. Diaz was talking about public policy and how you can help, you guys can fix that. And I'm going to touch a little bit on what he said. The other thing is, I always recommend keeping your Medicare card. Don't go for the Advantage card or your Medicare Advantage programs. If you're healthy, it's great. If you're not so much. So it becomes a little bit more difficult with the Advantage plans to get what you need, especially with durable medical equipment. With women who are wearing prostheses, it's now called medical equipment. Not real sure why. I don't know who decided that. Anyway, with the healthcare, with the Advantage programs, a lot of times you get one prosthesis for life. With Medicare, you get one every 2 years, or if you're a double, you get two every 2 years. With bras with Medicare, you get 6 every calendar year. With some of the Advantage programs, you only get 1 or 2 bras. So, and with other durable medical equipment too. Same thing with some of the drugs. I know a lot of people go to the Advantage programs because of the drugs, but they can change their formularies at will, and we're going to discuss one of the things that Dr. Diaz had mentioned earlier about how they change their formularies. If you're self-pay, which I was for a long time, because for me to go through the marketplace and being a breast cancer survivor, even though in the state of Florida, if you've been breast cancer free for 2 years, they can't deny you insurance. They can charge you. So for me to keep my docs, and my docs are all at UF, that's where I did my medical training. I was born and raised in Gainesville. I am a true Floridian, and I am a Gator. But if you go to UF Health and you can write a check, they will discount it 64% right then and there. So I could drive for 2 hours, because I live in Ormond Beach, go see my oncologist in Gainesville, and my oncology check cost me $82 because it was discounted. So there's lots of ins and outs. When you go back to pharmacy and you're talking to Medicare, you see all these discount pharmacy cards. If you actually try to use them in your Medicare, that's Medicare fraud. You cannot use discount cards with Medicare. My daughter was a pharmacy tech and would get yelled at all the time because they couldn't, but legally it's Medicare fraud. You cannot use discount cards with Medicare. Now, if you self-pay for the prescription, you can. But if you're using Medicare, you cannot use it. The other thing with pharma is I was at a legislative meeting in Tallahassee, and we had a pharmaceutical attorney there. And one of my advocates, because I do a lot of training of advocates in research and public policy, and she had dual citizenship between here and Canada. So she asked the question of, why should I give up my Canadian citizenship when I can go to Canada and get all my drugs for free, where here it cost me an arm and a leg? And the pharmaceutical attorney said, well, no, you can't. And I went, excuse me, yes, you can. It's much cheaper in Canada. And she says, well, actually, we sell to the rest of the world a lot cheaper than we sell to the U.S. because they need it. So you can actually get your medications through Canada. There's specific pharmacies you need to use because not all of them are great, but it's the same box you get when you go to Walgreens or CVS here, and it's a whole lot cheaper. So that's another way to save money. I know some doctors say no, but if it's the same box and on it says it's made by the same company, it's the same medication. Also, what I learned from my daughter when she was working as a pharmacy tech at Walgreens is they bend over backwards with cancer patients to get, you've got to have a rapport with the pharmacist or the pharmacy tech, but they will bend over backwards to fight the insurance company. I know she stayed on the phone for an hour getting approval for a cancer drug for a patient. So be nice to them, be friendly. Take them a piece of candy once in a while. It's amazing what the pharmacy techs and the pharmacists are able to do. Not the pharmacy managers. Those are bad guys, to put it mildly. As far as where you can get other financial assistance, there are a lot of nonprofits out there with breast cancer because the majority of breast cancer patients are women. We tend to have big mouths and outspoken. There seems to be a lot more for breast cancer than it is for others, and it's true, and that's why a lot of us are going into other cancers, because if you know cancer, you know cancer. You may need to know more about that specific cancer, but basically what you go through with treatment is pretty similar. But there's a lot of organizations, nonprofits that raise money to help. We used to have a Susan G. Komen affiliate that the 9 county areas covered in this area was in that. It dissolved in January. Florida Breast Cancer has stepped in and is now taking over what they were doing. But Komen granted out money to small nonprofits to cover medical expenses. They would cover mammograms, biopsies, all the way up to genetic testing. Don't have enough money to cover treatment or chemotherapy. And also they would cover rent payments, car payments, groceries, if you needed that while you were going through treatment. There's a really good organization that covers this area called Ribbon Writers that does that as well. But there's a lot of small organizations like that locally that have money to help if you need financial assistance with co-pays, like I said, mortgage payments, regular bills, as well as some of the medical procedures. There are a lot of state ones. Florida Breast Cancer is one of them that helps as well. You've got a lot of national, like Komen, you've got Medivivers, you've got MedUp. Oh God, I couldn't even begin to tell you all the different names. One of the great ones that I like is the Patient Advocacy Network. It helps all patients, not just cancer patients, but you know when you get the EOBs, the explanation of benefits from your insurance company about what they paid, make sure you read even the fine print, because a lot of times you'll get a bill from the hospital saying you owe this, but your EOB in very fine print says you don't. So make sure you read everything. And don't throw away the EOBs, because I'm doing taxes right now, and they come in really great when Medicare sends you what you're supposed to pay, and you can look at what you're supposed to pay and if you actually paid more. What happened with this one patient is she kept paying this bill, and she kept telling them she paid it, and they said no, she hadn't. So she contacted the Patient Advocacy Network. They went to battle for her and actually got her $40,000 back that she had overpaid. So They're also really good at helping you fill out insurance forms, claim forms, getting bills processed. They're a tremendous organization, and it, again, is all free. The other ways you can find help is through your navigators, and there are several types of navigators. You've got a patient navigator who, sort of like what I do, a patient navigator is usually not a nurse navigator. They're usually a survivor, because navigation actually goes from screening all the way to survivorship. So it includes treatment and all of that. If you've been a survivor and you've walked in my shoes, you get it. If you haven't walked in my shoes, you really don't get it. Our mindset is totally different. Our normal is totally new. I've had people come up to me and go, well, it's 14 years, get over it. But every time I get a pain, especially in bone, the first thing I think of is, oh my God, is it back? So ignore those people because they don't know what they're doing. The other thing is the nurse navigators, who are great through treatment, are real good. In a lot of cases, they can set you up with a survivor who can talk you through your whole journey, because it's really nice to have somebody who's been there, done that already. They can give you little tips that if you get mouth sores from chemo or some nausea, they can give you little tips, different foods you can eat that may taste okay, where your sense of taste may be off. But a survivor who's been through it knows these tricks. Again, if you haven't been there, you don't know. The other thing is social workers. Social workers are also a good person to contact to find where money is available. Florida Cancer Specialists, who I love, have their own foundation to help patients. So there's lots of money out there if you know where to look for financial assistance, whether it's for copays, whether it's discounts on studies, whatever. We have a program in Volusia County that if there's a woman in need, we have a breast surgeon who donates his time, an anesthesiologist who donates their time, several nurses, and they will do anything from a biopsy up to a total mastectomy for free, and all the well, not for free, but all the patient pays for is for the supplies needed, so the gauze and that stuff. So there's a lot out there if you know where to look. The problem is you need to get to one of us who knows where that is, and those are your navigators, whether it's patient, nurse, or social workers. One of the biggest things we see a lot is, as the doctors have mentioned, cancer treatment is really expensive, and a lot of people end up going through bankruptcy. And everybody goes, oh, that's bad, you shouldn't do that. Well, bottom line is sometimes you have to. Personally, we had to. When I was diagnosed, got through surgery and all of that, had health insurance. My husband's business cut out health insurance after that, so everything else was left on me. So I had to find how to get everything paid for. And I got the treatment I needed, but when it came down to, at the end, going through it, there was no way I could pay for everything, and we had to file bankruptcy. Yes, it ruins your credit, but it's an option. And I've had one patient who actually divorced her husband, so their home and everything wouldn't be touched, and she could get the treatment that she needed. So there's some really hardcore ways to get through the treatment. I don't always recommend all of them, but again, as I mentioned with caregivers, they're your best support. And if you've got another survivor who can be there and hold your hand, it's amazing what they can do as well. As far as hospitals, there are 13 regions Florida's divided into for indigent care. These hospitals have to treat you. It's not like some of the for-profits that all they have to do is stabilize and then transfer you someplace else. But they get federal and state dollars for indigent care. Not saying that you're indigent care, but if you know someone who does. So those are other ways. I know Florida Cancer Specialist, UF Health, and Moffitt have never denied a patient I've referred to them. They've always taken them in and taken very good care of them. There is another program, it's called the CCRAB, it's a Cancer Collaborative Research Advisory Council of Florida. Rick Scott put it together. They are to protect cancer patients and make sure you have access to care. So if there are any issues, all you have to do is call the state office or call one of us who is on the board, and we can find out information. We have the ability to send out through a listserv throughout the state of Florida to find out who's available. If we have somebody who can't afford treatment where they are, we send it out through the listserv. We have always had doctors step up, pharmaceutical companies step up, and we've gotten what we needed for the patient. If the patient doesn't want to travel, we can't do a whole lot about it. But again, there's lots of ways out there for travel. You've got Angel Bus, I think they've changed their name now, that if you have to go 75 miles one way, they'll cover it. Either put you on a bus, put you on a plane, pay to have somebody drive you, give you a gas ticket. So those are ways, because the American Cancer Society has cut back on a lot of things that they were doing. I wanted to touch on a couple things Dr. Diaz mentioned on public policy, because there's some legislation that we've been trying to get passed, and we've got a few, I won't mention names, legislators at the state level who are blocking it. But one of them he mentioned was the Mary Brogan Act. That's the breast and cervical early detection program. We have got, Florida is one of 5 states that the state does not match the federal funds that we are given. And that is, if what the Mary Brogan program is free breast and cervical cancer screenings for women between the ages of 50 and 64. At 65, you have Medicare. At 40, there's other agencies that can take care of you. But if you're 50 to 64, it's a Mary Brogan program that you're going to go through. If you were diagnosed with breast cancer and did not go through that program, you cannot get state assistance, and there is no recourse. And that's one thing we're trying to get out to people, is that doctors, nurses, health departments, they need to know that if the woman is between 50 and 64, they have to go through the Mary Brogan program. The state of Florida only gives a recurring every year $300,000 to the Mary Brogan program. We've been trying to get them to match federal funds forever. I think ACS is the lead on this, the American Cancer Society. So I can, if any of you are interested, I've got cards. I can send you the points on the Mary Brogan program, because it's a budget line item. It's not a piece of legislation. So I think we're going for 2.2 million this year is what we're asking for. We got 1.8 last year. But it's a program that we desperately need, especially for these women between 50 and 64. And what a lot of you may not realize is, with breast cancer, close to 40% of the men leave their wives, which means you just lost your insurance in a lot of cases, your everything. So the Mary Brogan program is really important. The other one was the Fail First, which it's pharmacy managers practicing medicine, as Dr. Diaz says, and it's horrible, but basically what it does is the doctor tells you, I want you on this medication, and then your insurance company, the pharmacy managers, basically say, well, no, you have to fail first before you can have this medication. That can take up to 3 months or longer. I testified in Tallahassee last year on this program, and I got a real kick out of it, because one of the Senator Mayfield, who I really like, she lost her husband to cancer and always supports us on any cancer legislation. The insurance guy got up there and said, we don't like the term of the bill. We don't like fail first because it's negative. And she looked at it and she says, but isn't that what you tell the physicians when they call? They must fail first before, and he had no answer. And then one of the other senators asked, well, can you tell me that there's no cost-effective reasoning behind this, that you're not trying to cut costs? And the insurance guy started dancing. I mean, literally started dancing. And the senator goes, that's a yes or no question. What I think people should do in the state of Florida, well, anywhere for that matter, is I think you ought to spend a week in Tallahassee during session and just see how the game is played, because literally it's a game. Same thing in DC. Walk the halls of Congress, watch what happens. It's very enlightening. You'll also find out that in Congress it's run by 20-year-olds because, Dr. Diaz, am I wrong? All the staffers, your chief of staffs are usually older, but everybody else is in their 20s. And it's really kind of scary when you're walking the halls and they're, a third of your age, but that's who's running the country. The other thing is the bait and switch bill. The bait and switch bill is one where when you have your open period and you're signing your insurance, you usually are looking at what pharmacy benefit you want, and you're picking it by the pharmacy benefit. But they can change that formulary whenever they want. Now, you just signed a contract with them for a year, right? And it's a matter of contract law. But no one holds them to the end of that contract, and they can change that formulary. So you got your medication this month, you go back next month, you can't get that medication because they took it off the formulary. What the bait and switch bill does, it will block them from being able to do that, so that when you sign that on the dotted line that you're signing for that insurance policy, that day, that formulary stays the same for that entire year. They can add to it, they cannot delete. The only deletion can happen is if the FDA says there's a problem, then the drug can be deleted. Other than that, that formulary stays in place, because it's not fair when you guys sign a contract and that drug is on your formulary and 2 months later you go to get it and the drug's not there. All of this is legislation we're trying to get passed. As Dr. Diaz says, it's really important. You guys can make the difference. They listen to the docs, but the patients' voices count more. I actually have an advocate, if she'll stand up in here, Teresa Shepard. She just started me this year with public policy and research advocacy. She's a 20-year metastatic survivor. And we do through Florida Breast Cancer Foundation and working with some of the groups at University of Florida, University of Miami, UCF, Moffitt, Mayo, Cleveland, basically most of your cancer centers. We are training more and more advocates for research and for public policy. So if you're interested, by all means, track down Dr. Diaz, track down me. We always have trainings. The more voices we can get for those who are in the trenches fighting, the better it is for us, and the better we can help to make things more affordable. So thank you.